So we had a testimonial, and you had a pretty good outcome after my surgery, which was a 5-level scoliosis procedure just about 4 months ago. And but we talked about that about a few weeks after the surgery you had a mini stroke. Is that right?
Right.
Okay. Now, how did you notice you have a stroke? What were
Well,
the symptoms?
they noticed it. My wife noticed it more than I did. I was just kind of just
Mumbling or
no,
that,
no.
what?
He dropped his dinner plate, and
Oh,
also
okay.
the answers that the physical therapist was coming, and she and I asked him some things, and they didn't make a lot of sense.
Yeah, and that
So-
happened like within weeks after the surgery,
Yes.
right?
Yes.
And now the question is, you went to a hospital, they started you on anticoagulation, and I understand that you actually improved and everything got better again,
Oh yeah,
right?
it
Yeah.
didn't take any time. Maybe
Yeah.
about a week to.
Yeah,
It affected my speech a little bit.
yes,
But
and
that's all gone.
yeah, and I think that they even called me because so short after a 5-level scoliosis fusion, if you start anticoagulating, people will bleed to death, or they push on the spinal cord and go paralyzed. So they always are careful. They ask me. My answer to them was no, go ahead and do anticoagulation. We lost 100 cc of blood, which is nothing, and because we don't cause too much damage, there is not much a place to bleed into. So for you, it was safe to get the anticoagulation, and obviously that helped you.
Yeah.
You recovered from that because they could do a full treatment of your stroke or mini stroke or maybe whatever the situation was with anticoagulation. Whereas after open surgery, you had to choose function of the brain or function of the spine, and with the bleeding, that could have been a life-threatening situation after a scoliosis surgery. So in a way, doing it minimal invasively doubly helped us. You just told me you walked same day after
Yeah.
the surgery, you went home 3 days later, and the pain is practically, for all practical purposes, gone.
Yeah.
You couldn't stand, now you can stand, and so overall the surgery helped, but it helped us in a second way as well, because it allowed us that after you had the situation with the stroke, to get a full treatment for the stroke. So that's actually a double kind of improvement on what's out there. And realistically, people will have heart problem, stroke, and these are realistically things that people in our age group have to expect.
Yeah.
So, well, but you stayed in the hospital after the anticoagulation for a few days. Is that right?
2 days, yes.
2 days, okay. And then they send you out, and they're still checking on you. Are you still on anticoagulation?
Yeah.
Okay.
I think they never said I'd ever get off of it.
Yeah. They
So-
usually keep you on that for a while. But when you were in that situation, how did they deal with that? What did they tell you about? You just had a big spine surgery. Now we have to anticoagulate. What did they tell you?
Well, my daughter went with me to the hospital, and at first I don't remember a lot of it.
Yes,
but,
yes.
They told me to just go home and do whatever you'd done before. You know?
Yeah. But did they tell you about how they are going to treat your stroke? And did they tell you that they're with your spine problem, that the concern of bleeding?
No, they weren't concerned. They got me
Yeah.
up right away and walking. And
Yeah, because they called me.
Yeah.
Because they called me and they asked me
Yeah.
if that would be all right. So they could reassure you all of that is all right.
Yeah.
Usually it is not. Well, thank you again. I appreciate that.